concerns about the fluoride in our water.
Mm-hmm.
I know I went to a day-long
Yeah.
educational thing.
Yep. We were
Can
there
you
too.
share? Yeah, you were there as well, and so where do you stand on that?
Well, I mean, it's not something that I personally stand on. I think it's something that the voters have to stand on. You know, there is a lot of debate in the country about a whole host of public health issues right now. And as far as the dental community is concerned, they are still in favor of community water fluoridation, and I think that's where we have to rely on the expertise. So, you know, we concentrate on offering the dental treatment because that's something that we can do locally, and I have to give a shout out to folks like the National Guard and other dentists who are volunteering their time on the dental van to help treat children in the city, and we treat about 600 children every year and offer them free services. So we spend a lot of time in trying to provide education as well. So we talk to them about, you know, brushing regularly and you know, all those good hygiene practices. So that's where we spend our time, you know, mainly. But certainly there's lots of conversations across the country right now. And, you know, I commend you for showing up and trying to educate yourself. And we had a conversation about that, you know, you're just trying to get facts straight for yourself and your constituents. So I appreciate that.
Yeah, I just believe in freedom of choice. We should bring it to the voters for that. A couple questions on the reduction in overdoses.
Yes.
We discussed this before. So with that, we don't really know how many overdoses we have.
Correct.
That are really going on because of all the Narcan that's given out like candy, which is a problem because we have non-medical people distributing Narcan, which is medical. It's, you know, so I think it's really hard, and it is misleading to the public to really state that we have really gone down in overdoses when we really don't know.
Yeah.
And we do get a lot of phone calls on the call log for overdoses, and, you know, so I guess there's like a lot to it, and I know you have a big job, and I really appreciate this presentation, but I think that that's a part that is a problem because there are so many people suffering, and I just believe we need to find a way to lead them into recovery.
Yeah.
In a better way, instead of handing out needles, which I know we don't hand out needles, but
Right.
other organizations hand out needles within the city, which is a problem.
Yeah. Well, I'm going to stop there with that because that's not something that we've had control over, as you know.
I do know that,
unfortunately.
and that's why I brought that up.
Yeah.
You know.
Yeah.